If you're working past the age of 65 and you have health insurance through your job, you may be considering delaying Medicare, and in some situations, that might be the right call. But in other situations, delaying Medicare can lead to penalties and other issues that may follow you over time. And the tricky part is, it's not always obvious which situation you're in. In fact, many people who have health insurance through their job assume they're safe to delay, and quite frankly, that's not always the case. There are in fact certain requirements that you need to meet in order to delay Medicare without any issues later on. And while it may seem simple at first, there are a few crucial details which people often overlook. So in this video, I'm going to break down exactly how this works to help you avoid mistakes which may end up costing you in the long run. My name's Eric and I'm a licensed Medicare agent, and I wanted to go over now the first rule that people tend to miss when understanding when they can delay Medicare. And that is, if you want to delay Medicare Part B without any penalty, you typically have to have group health coverage based on current active employment. And this coverage can come from your own job or from your spouse's job. But there are two key words there, and that is current and active. And that means that someone is still currently working and that coverage is tied to that ongoing employment. And this is where a lot of people run into trouble, because there are certain type of coverages that look like they should qualify, but technically don't under the Medicare rules. And one of the most common examples of this is COBRA. COBRA is a federal law that allows you to temporarily keep your employer's health insurance even after you have left your job. Now, on the surface, it can look very similar to the coverage that you had while you were working, but this is where the confusion comes in. Because what many people will do is leave their job, elect for COBRA, and then assume that they can delay Medicare because they have that coverage after they have left their job. But the thing is, Medicare doesn't view COBRA the same way. And that's because COBRA is not considered coverage under current active employment. So if you're relying on COBRA and you haven't enrolled in Medicare when you were eligible, a few things can happen. First, you may receive a late enrollment penalty for Part B. And secondly, your COBRA insurance may not work the way you expect it to. In many cases, it may only pay as a secondary plan, which may leave you vulnerable and open to a lot more expenses than you had anticipated. And then there's something else to be aware of, and that's that your special enrollment period for Part B typically begins when your active employment ends and not when your COBRA coverage ends. So even though COBRA may last for several months, that enrollment window period may be open and running in the background. And then if too much time passes, you may miss the opportunity to enroll without penalties or delays. And if you miss that window, you may have to wait for the general enrollment period, which runs from January through March, with coverage starting later that year. And depending on your timing, it may create a gap in your coverage, and so you can see how this could become very confusing. Now, the next rule to consider when deciding whether or not to delay Medicare has to do with your employer size. Now, if your employer has 20 or more employees, typically they will become your primary insurance and Medicare will become secondary. But now what happens if your current job has fewer than 20 employees? Well, in those situations, typically Medicare becomes your primary and then your employer actually becomes your secondary coverage. So if you haven't enrolled in Medicare when you're eligible, that primary coverage may not be in place. And then your employer may only pay the portion that they would be required to cover as a secondary plan. And then this can leave you responsible for more of the cost than you had anticipated. And this is why understanding your employer size is so crucial, because it can directly impact how you are covered. Now, when it comes to prescription drug coverage, the rules work a little differently. Now, to delay Medicare Part D without a penalty, your current drug coverage needs to be what's deemed as creditable. And all this means is that your plan is expected to pay as much as a standard Medicare Part D plan. And this is something your employer is required to disclose to you, typically through a letter which they will send out annually. And if you're not sure if your drug coverage is considered credible, reach out to your HR department and they should typically be able to answer that question for you. So just to bring it all together, if you want to delay Medicare without any penalties or issues, there are a few key things to keep in mind. First, you or your spouse need to be actively working. Next, your coverage needs to come from that active employment. And your employer typically needs to have 20 or more employees. And when it comes to prescription drug coverage, if your current plan is considered credible drug coverage, you can typically delay without any penalties. Now, when that employment ends or that coverage ends, you typically have about 8 months to enroll in a Part B plan without any penalties. But it's important to keep in mind that window usually opens the month after your employment or your coverage ends, whichever comes first. Now for Part D, the window is shorter. You typically have about 63 days after losing credible coverage to enroll into a new plan without any penalties. Now I know this seems like a lot to take in, and for that reason a lot of people just say, I'll deal with this later, or it's not that big of a deal. But it is a big deal. And to show you why it's such a big deal, I'll give you a couple examples to help illustrate my point and why you really want to be on top of this. So let's say someone just turned 65, they've been with their employer for years, and they have what they assume is strong coverage through their employer. They assume everything is fine, and so they decide to delay enrolling in Medicare. But what they didn't realize is that their company only has 15 employees. And because of that, Medicare is generally expected to be the primary coverage. But since they didn't enroll, that primary coverage is not in place. Now, if they need medical care, their employer is only going to pay the portion that they are expected to pay as a secondary plan. And that can leave them responsible for more of the bill than they had expected. And to make things even worse, they may incur a late enrollment penalty when they eventually do sign up for Medicare. And this is where things can really start to add up, because that Part B late enrollment penalty is not a one-time fee. In fact, it gets added to your monthly premium. And in most cases, it increases your monthly premium by about 10% for every 12-month period that you were eligible but didn't enroll. And once that increase is applied, it can stick with you for as long as you have Part B coverage. So for example, if someone delayed enrolling for 2 years, it could add roughly $40 to their monthly premium. And over time, that can add up to several $100s per year on top of what you're already paying for your monthly premium. Now the Part D penalty works a little bit differently. It's based on about 1% of the national base premium for each month you went without credible drug coverage. So if there's a gap spanning several months, it can add a little bit extra to your premium. And just like Part B, that penalty can stick with you for as long as you have Part D coverage. Another thing to keep in mind is that base premium used to calculate your penalty can change over time. So the actual dollar amount can change from year to year. The important thing to understand here is these aren't one-time fees. These are monthly increases to your premium that may stick with you over time. So if you're currently working past the age of 65 or you're planning to, this next part is especially important. I'm gonna walk you through a simple checklist of what to verify and who to talk to make sure you're making the right decision. The first is to check with your HR department and verify how many employees your employer has, including all locations. For many companies, especially large companies, this may be obvious, but if there's any doubt or uncertainty in your mind, it's important to verify. Second, confirm that your coverage is based on active current employment and not on a retiree plan or COBRA, because Medicare may view these differently. Third, ask whether your prescription drug coverage is considered credible. If you want, get it in writing and keep that in your records just in case you ever need it. Fourth, if you have a health savings account or HSA, be aware that enrolling in Medicare may affect or impact your ability to contribute. So it's a good idea to confirm the timing to avoid any unexpected tax issues that you may face later on. And fifth, when you eventually retire or lose your coverage, make sure your employer completes the CMS L564 form. This is a form that helps document your prior coverage and can be used when you apply for Medicare during the special enrollment period. Now, following this checklist doesn't mean you can automatically delay enrolling in Medicare, but it can help you avoid common misunderstandings and help you make a more informed decision. Now, if you want to make sure you're not only delaying Medicare the right way, but also choosing a plan that's right for you when the time comes, watch this video and I'll show you why most people end up choosing the wrong Medicare plan and what you can do to go ahead and avoid those common mistakes.